Hello, this is Anne DeGheest, and it's Friday, July the 24th, 2020, and this is the Anne Insights channel. Today we have two videos we are recording. The first one is on the epidemiology of the SARS virus, and the second one, which has a lot of information today on the clinical changes of the virus, how to do the treatment, what you can do to protect yourself, and how to reopen school. So please make sure you see the second video. So let's focus on the first part today, which is the epidemiology. How is the virus spreading across the world? Again, I want to reemphasize, we need your help to post these videos to your friends and social networks so we can change the culture, which is right now an individualistic culture of me, to a culture of us. It's important that people understand it's not just to protect themselves, it's to protect their friends, their family, and other people around them. It's to allow small services, businesses to stay open, like restaurants, and allow the school to reopen, and to allow women who are working to be able to keep their jobs. And it basically help the economy to go back up and basically help people to be successful and happy in their life. So please help me spread the word. Let's talk about the epidemiology. So today we're going to talk about the fact that India is clearly climbing. You can see in the dark violet curve. Brazil, that seems to be plateauing, is having a spike. And unfortunately, the US continues on its course upwards. Mexico is a steady heady there in a number of cases there. In the second part of the video, which is the clinical update, we'll talk about immunity and airborne transmission. So Europe has shown that you can successfully implement social distancing and face mask and stop the progress of the disease. In the dotted red here is the UK. And the UK initially did not put restriction in place. You can see the explosion of the curve, and then they had a very high mortality rate and a lot of social pressure, and they start putting some restriction in place. And typically you can see there's like 3 to 4 weeks delay until you start seeing the curve going downward. So it can be done. And I think we in the US should be able to do it too. In the world right now, we're accelerating, unfortunately, the virus spread to 247,000 cases per day. The US has passed 4 million cases. Brazil is at 2 million, and India at 1 million. And Mexico is climbing upwards. And so unfortunately, the virus now has spread all over the world. If we look at the specific on the daily cases, unfortunately, you can see Brazil is sky up and is now very close to the US. The US had 63,000 cases yesterday versus 60,000 by Brazil. And you can see India is climbing straight up. You can see in the curve here, India is climbing straight up. So in the coming weeks, I wouldn't be surprised if India may pass Brazil and the United States. As a world, we're steady heady in the rise of the number of cases, and you can see the number of deaths is climbing up. On the dashboard of the world, the US had 63,000 cases, 7-day average of around 67,000. Brazil was having a plateau, but having that surge. We have to see if it's an issue, if it's a new surge, or if it's a data reporting issue. And India is averaging around 35,000 cases a day, clearly on the climb up there. Russia is clearly controlling it. South Africa, we know there's a small outbreak there. And Peru, there's an issue there. It looks like it's going downwards, but we're going to see later on there's a lot of mortality and data reporting issue there. And Mexico, unfortunately, is clearly climbing up. Looking on the 2 weeks growth basis there, which smooths a lot of the data reporting issue, the good news, Australia, which was red hot a couple of weeks ago now, is back into some control. There was an outbreak in Melbourne, and they did a lot of social distancing and shelter in place. Unfortunately for us, Brazil and United States is still red hot, in the number of cases growing in a period of a 2 weeks period of time. Testing, a huge difference. Look at testing of Russia. They've done 22 million cases. If you do the test on a normalized basis, which is 151 per thousand, we compare this to the US. Russia has done 5 times more tests than the US. And you can see India is having a huge problem there. There's not enough testing, which is why they're having this massive coronavirus outbreak in the community there. Positive rate, not surprising, South America there, there's not enough testing. So when you don't do enough testing, what's happening is that the number of cases are extremely high because you test people who are in the hospitals and with some serious symptoms. To give you an idea there, if you look at the mortality rate, Peru, and if you do it on the number of new deaths per million is 117. So they clearly have a massive outbreak on the mortality rate. Same thing for the total deaths per million. It's 535 per million. And these are confirmed cases. And that was telling you that the testing and the positive rate, which is so high, is a function of a massive outbreak in Peru. Brazil, very high mortality rate of 395. Let's compare this to the US, it's kind of roughly at the same range there. And compare this to Russia, which is 88. So Russia is like 1/4 of the mortality rate of the US. Fatality rate, another way to look at this is that we know that Italy had a very old population there, so they hit the mortality rate, fatality rate of 14%. Mexico, this is really worrisome. Mexico is going straight up there, has passed Spain, and is showing this mortality rate of around between 11 and 12%. Sweden had that outbreak there that they decided not to control, is slowly coming down in the mortality rate. The average, like the US, is around 5%. So people have asked, what's the difference between the flu and COVID? And the first thing is that what's called the RNA, which is the number of people you infect if you're contagious. And typically the flu, it's a ratio of 1.3 to 1. In COVID, it has been reported to be as high as 2.5 to 3.5. And the big problem with COVID is that it takes you 14 days where you could be asymptomatic, where you can contaminate people, where typically with the flu, incubation time is a couple of days. And the big difference too, of course, is the fact that 20% of the patients end up in the hospital as opposed to 2%. So that's a 10x factor there. And as a result of that, the fatality rate is a huge factor difference. So what's happening in the world? Brazil is spiking. And we thought that there was a bit of a control there, and maybe it's a data reporting issue there because the trend is pretty much on the upswing. And they have now reported over 2.3 million cases and 84,000 deaths. US, as we all know, has passed 4 million cases and 144,000 deaths. There may be a slowdown here, but that's a bit too early to tell. Mexico, there's a hope it's slowing down, but we have to see how much of that is reported case data issue. India, unfortunately, that's pretty much on a growth curve that's accelerating. So that's very worrisome. The positive test rate, about 5%, that's the goal of the World Health Organization, is to stay at 5% to control the pandemic. And you can see we have data from Peru at 47%, which again shows that only the people very sick are getting tested. Brazil is at 32%, Mexico is 24%. So we really don't have a good handle of what's happening in those countries. The US, 4 million cases, that is astonishing, 145 million deaths and climbing. And most of that are being driven by Florida, Texas, California, Arizona, and Georgia. That's kind of, but there's growth in the other states. To give a perspective, we went from 0 to 1 million cases, in probably 100 days. We went from 1 to 2 million cases in 44 days. And now we're doing 1 million cases every 2 weeks, which means we're going to probably get another 1 million cases by early August. The good news, I'm trying to get some good news. If you look at my video 1 or 2 weeks ago, the whole sector there was dark red. The south, southeast, all those states were growing at over 100% on a comparison on a 2-week basis. Now, there's a bit of a slowdown. It's only 50% instead of over 100%. And we had numbers as high as 180% last week. So you can see there's a bit of an improvement there. And it's still growing at 55%, which is nothing to brag about. But at least it's slowing down. And that just may be because the number is so big that, the curve has to slow down. Is there a plateau? That's the hope. A bit early to tell, so we need to keep an eye on that. As you would expect, the mortality rate is going up, as there's typically a 3 to 4 weeks delay between an upswing and a mortality. So we should expect the next 4 weeks to be very difficult with significantly higher mortality than what we're having right now, which is 1,000 cases a day of people dying. More hotspot. Graphically, this is the graphic we had a week ago, and you can see we have more hotspot outbreaks. So although the states overall seems to not having this huge acceleration of growth, there's still more and more hotspots. You can see New Orleans, Mississippi, the whole area there is significantly redder than it was a week ago. And then we have some problem here in Arizona and some part of the Central Valley of California that wasn't there before. Comparing state week to week, again, smoothing the curve of data reporting. And unfortunately, the Southeast and the South and the West Coast, it's, if you look at the yellow curve, this is when the cases have been rising for 2 weeks in a row. Most of the states are on a growth curve. The US as a whole has grown over 14% in the last week in the number of cases being reported. And we have had 464,000 new cases in 1 week. Florida is 80,000 cases, Texas 66, and California around 64. So these are massive numbers, and you can see the growth rate is still unfortunately very high. Good news, if you look at the state RNO, and this is the one from a week ago, you can see most of the states were above the 1, which is the target to control the pandemic. Some of them were as high as 1.6, which is very significant. And there's a bit of the extreme going down a little bit there. And we have a few states that seems to have had some control. So that may be good news. And this is an analysis done by JP Morgan. And what they show is that if we start with an RNO of 3.3, and what can we do to drop it below 1, which is kind of the objective that we're trying to do. And the biggest impact is wearing the mask. Okay, so how do we get perspective on 140,000 people who died? And to get perspective, let's look at how many people die from the flu. And pretty much we have beaten any flu season since 1918, where we lost in the pandemic 675,000 people. We have now lost more people than in World War I, soldiers who fought for World War I. And we have now the leading cause of death after heart disease and cancer is COVID. Now we have to remember that if you look at Europe, it goes straight back up, and then on the way down, it's a slower curve. So we're going to at least double the mortality we've achieved so far. So I wouldn't be surprised if we go from 140 to around over 300,000, and maybe even past, depending what's happening this winter, the number of deaths from World War II. That is staggering. And that's why I think we need to take this seriously. So how do we do the back of the envelope on the mortality rate? We know that 30 to 50% of people are asymptomatic. Around 80% of cases will be mild to medium and can be taken care at home. And 20% will end up in a hospital. And in the hospitals there, the average mortality rate is 25 to 30%, with around a third of people on ventilators, and the other 2/3 being on oxygen treatment on the hospital floors. So do the math, 20% multiplied by 25%, that gives you a 5 to 6% mortality rate, with the majority of people being over the age of 65 years old. In fact, the risk of dying is 20 times higher if you're above 65 years old than if you are below 65 years old. An interesting analysis just got published. And what they did is that they look at the aging of the age of the population. So we know, for example, Italy had a very high mortality rate, but they have a much older population. And so what they did is an analysis of the population by different age groups, and they readjusted the fatality rate on a normalized basis. And what you see is that on a normalized basis, Italy mortality rate went from 9% to 3.9%. And so as a result of that, 66% of the variation across country is being explained by the age of the population. But astonishingly, Germany, who had a very low mortality rate, should have had a higher mortality rate based on the age of their population. So they did an amazing job. They cut by half the fatality rate that other countries did. So it's an interesting analysis, which clearly showed that Europeans have an older population. In the United States right now, we're pretty much on target, regardless of the age of the population. We have a younger population than Europe. The CDC did some seroprevalence, which means they test the whole population in a certain area, therefore looking at the antibodies and see how many people got exposed. And then they came to the conclusion that we may be underreporting up to 10x the number of positive cases. So then the question is that, The fatality rate I was just talking about is the number of confirmed cases divided by uh, the number of confirmed deaths divided by the number of confirmed cases. So there's two things we need to assume. One is that there is excess deaths that's not being reported, and I'll talk a bit more about the fact that it could be as high as 50 to 100%. And we need to divide that by the number of unreported positive cases, which we think could be as high as 10x. And the analysis show that if that's the case, and this is a JAMA paper based on antibody tests that have been done that I just showed earlier, that the mortality rate in the US may be 1.5%, and China was 0.6%, but still for people over the age of 65, it's 5.6%. So it's still pretty high. So it's an interesting paper. Again, there's a difference between what's confirmed versus what's being assumed. So let's talk about the excess death. So the idea of the excess death is that you compare what the mortality should be historically. So for example, in the US, a company called Epic has access to roughly 80% of the largest healthcare system in the US. So they took this database and they say, historically, what should have been the mortality rate for this time period? And then you compare to that the number of deaths, which is the very dark red graphic here, that was reported. And the difference between what was reported for COVID, which is in the pink color, and what was reported, that difference here is the excess death. And so to give you an idea, in Mexico, we're underreporting by a factor of 3x at least. And so they reported 6,000 deaths, and there's been an excess death of 22,000. That delta there is massive, and we already have seen that Mexico has a higher mortality rate. In Peru, that's even bigger. Peru is over here. They reported 9,000 deaths, and we know there's an excess of 36,000 deaths. So the excess deaths is all over the places in different countries. Belgium, for example, has a pretty much on target, and they have that 16% fatality rate, but they may be the only country that's honest in reporting the data, or at least making the assumption of what the data is. So these excess deaths can be very significant in the delta. Internationally, if you look at the deviation from what's being reported versus the what's missing, you can see that Mexico is really up, to over 200%, and so is Peru, and Brazil was around maybe 50% there. So and then Belgium, which had this really high fatality rate, is right on target. so there may be a lot of unreported deaths that we're going to learn. If you look in the US, you can see that New York has an excess death, which is probably around 30% there. New Jersey is a bit higher than that. That's close to double. Massachusetts seems to be on target. So there's a difference in the way we're doing the reporting. And there are some states in the US, for example, who don't report death in nursing home. And we know from other states that the mortality in nursing home could be as high as 40 to 50% of all the COVID deaths in that state. Again, Belgium, you can see, is right on target. They kind of seems to have got the curve, but Spain, for example, is underestimated by a factor of 2x. Same as the Netherlands. So again, that's something we're going to learn as we study this virus more. And then Sweden seems to be pretty much on target, unfortunately, a high number. So by age group, not a surprise, most of the excess death is for the elderly over the age of 65. And so we have done this analysis in the flu season in the prior epidemic there in 2018. So this data is pretty interesting. So the US used to have a positive case rate of 4.7% in like mid to late June. And then right now you see the outbreak is clearly linked to the Memorial Day opening, and that 3 to 4 weeks delay that you have with spreading the virus there. And we have gone to 8.6%. So still growing, but not in an exponential fashion, thank God. Unfortunately, the testing is inadequate. The Northeast is doing great. But pretty much the rest of the country there is at only a third of the level of what we should be doing the testing. Right now we're doing 763,000, so it's going up, but our target is 2 million tests per day. And so some states, which are the states who have the highest positive rate, which makes sense because you only test the people who are really sick, like Arizona and Florida and Nevada there are totally under testing in their target range. So and you can see that's being tied to the hospitalization rate, like especially in Arizona and Florida there. So all those numbers are tied to each other. So that's still an F grade for the US. An interesting study by JP Morgan showed that we had the reopening, let's say in California here, and you look at the active amount of hospitalization per million, and then you can see after the reopening, it went straight back up from around 4 to 5%, which is the target, to this 7% rates there. So, and so Texas straight up hospitalization with that. Other states succeeded. New York, New Jersey, and Illinois were able to do the reopening progressively there and control. So it can be done. Let's take a look at Arizona, which is clearly a hot spot. And this new dashboard is showing that they're really in the red zone. In the daily new cases per 100,000, it's you're trying to be in the low zone over here. They're clearly going straight up at 40 new cases per day for every 100,000 residents. And to give you some perspective, that means that more than 50% of the people living in Arizona will be infected in the next 12 months. That tells you how aggressive that is. And the positive test rate is 24%, and they're clearly not doing any contact tracing because they have this massive outbreak. And here's the bad news. They are at full capacity as far as the ICU. An analysis they did is that if there was no restriction, what will happen to mortality in the next 3 days? And they will go from the projected mortality of 5,000 people to 9,000. So that's a huge delta in 30 days. Florida, it started in Miami-Dade. Now you can see it's pretty much spread for a lot of the different parts of Florida there. It's not as bad as Arizona, but we're still getting 52 new cases per 100,000, so it's still very high. The positive test rate is 19%, so clearly under testing capacity there and no contact tracing. So the outbreak, unfortunately, is not controlled. This is simple math. In the red color there is the mortality, and in the blue is the number of cases. As we reopen here, you can see there's that 1 month delay that is following the same curve that we had in the number of cases. So the next several weeks are going to be really horrific in probably a massive increase in mortality in the US. Texas, clearly the big cities like Houston, Austin, and Dallas are in the hot zone. They're having a 35 new cases per day for per 100,000, so not as high as some of the other states we just looked at. They have a 15% infection rate, but they're starting to get at capacity and clearly no contact tracing. So the pandemic is unfortunately very active. Let's compare to California. So California, unfortunately, now has reached 435,000 cases, which is more than New York. We're doing around 10,000 cases per day, which is a 24% increase. So that's going the wrong direction. And as a result of that, you can see the mortality, which we had control for a long time, has unfortunately gone up. Again, using that same dashboard, you can see the difference there. We only have 23 cases per 100,000, so significantly lower than the other state. A lower positive test rate, lots of capacity, so I think we're good there, and we're doing a much better job in contact tracing. Imperial County is the problem, and Imperial County is near the Mexican border, near San Diego, which is San Diego is over here. And you can see that there's an outbreak, full capacity for the hospital there in the ICUs, 38 cases per 100,000 there. So that's not a good situation there. Los Angeles, which is next to it, is having a similar type of situation that they have more capacity on the ICU. In Santa Clara, which a lot of us are living, is a much better situation there. It has gone up a little bit in the risk, so we've gone into the monitored county in the state of California, but you can see a positive test rate is 2%, so that's great. And we have a ton of capacity, so I think we may have an increase in number of cases there, but it's clearly not an exponential curve like we see in other states. Southern California is the hot spot. Clearly, the whole area in Southern California there is very, very dark in the number of cases being reported, and it's the Latino population. And the Latino cases is around 1,000 cases per 100,000, so it's 1%. And sorry, one per 1,000. But the it's double the Black and 3 times the white population. It has nothing to do with ethnicity. It's about the social demographics. They have lower income, they live in higher density housing, they have to work outside, so and they have a higher chance of getting exposed to the virus versus a lot of the white collar were able to work from home. You can see an increase in the number of hospital beds, but it seems that we're able to control the ICU beds. The big problem is the 18 to 49 years old. 60% of the positive cases is the young population. And they may not get very sick, but they're passing it on, and that's the problem. The test positive rate, has gone up to 7.5%, and we seem to be able to control it, but it's clearly an issue there in Los Angeles. That's where the outbreak is. To give you an idea, if you look at Imperial country, and if you look at the case rate per 100,000, and you compare Imperial and Kings to San Francisco, which I have to find here. I mean, it's massive, the difference there. I mean, it's close to 8 to 10x. So it clearly a different part of the states are in much better shape than others. Santa Barbara has a bit of an outbreak there, but low mortality rate. Imperial County has a problem there in mortality rate. So thank you very much for listening to this first video. Please look at the second video on the Anne Insights channel on YouTube. And this is the one called Clinical Reopening, where we'll be talking about school immunity and treatment. Thank you very much for listening.